Welcome to the National Health Council of Change. This is National Health Council of Zimbabwe. We are directly under the Ministry of Health and Childcare. We are mandated to coordinate a multi-sectoral response in HIV and AIDS. So we have managed to coordinate all the partners here who are providing services. We have the Ministry of Health and Childcare who are providing HIV testing services out there, the COVID testing and COVID vaccination. They are also providing management of the non-communicable diseases like hypertension and blood sugar. So as National Health Council, these are some of the activities that we do. We have the models like the sister-to-sister model, the parent-to-child communication model, and we also do guidance and counseling training for teachers. And for the sister-to-sister model, we do with adolescents, girls, and young women who are underprivileged. They undergo some training. The purpose is to reduce the impact of HIV amongst all the sectors in the community. So this is what we do as National Health Council, and these are some of the partners that are here providing different services. Yes.
No, thank you very much. I think it's very clear.
Yeah. Yes. So we are screening for uncommunicable diseases such as hypertension and diabetes mellitus. So as people are living with HIV and developing with diabetes, they end up developing hypertension and diabetes mellitus. So in order to help them to get a longer life, we are screening for those diseases and they will be dealt with accordingly.
And one of our important projects this year is we've been partnering with the Zimbabwe National Network of People Living with HIV to feature heroes in the HIV response here in Zimbabwe. So people that have done extraordinary work in their community to get us to the place that we are now at almost epidemic control. So we wanted you to have this calendar, and we be reminded of our heroes throughout your 2022. Thank you very much.
Mwari Baba, Mwanakomana na Mweya Mutsvene, tinovonga nyasha dzenyu dzinogara nokusingaperi, dzinorarama madziri zuva rimwe nerimwe. Kushayiwa chete meso emweya kuti tione zvose zvinoitika mukati muupenyu hwedu. Ingawali chiprofita chakataura kare kuna Isaiah chapter 43 kuti kunyangwe mukapinda munzizi dzine hasha hamungakukurwi, kunyangwe mukapinda mukati memoto hamungatsvi. Chokwadi nzizi tadziona dzine hasha dzinotikukura mukati mumusha uno, mukati menyika ino nemukati repasi rino, asi hatina kukukurwa, hatina kutsva. Miromo yedu yakafanira kukuvongai Mwari, zvikuru panguva yakaita seino, iyo yamunotimutsira vaprofita venyu, yamunotimutsira vana venyu, kutitumira nemishonga nemiti yemidzi yemubhasami kuzotirapa. Tipewo mweya wokugashira kurapika, tipewo mweya wokugashira kubvisa uori pakati pedu, kuti inequality igoregedza kurarama pakati pedu. Baba, tinoziva nyangwe patinosimudza mibvunzo yakawanda, muri kupi Mwari pazvinogozha kudai? Muri kupi pazvinorema kudai? Ingawani munotaura kunesu, munesu munguva yatinoremerwa, munguva yazvinogozha, munotaura nesu, munotitakura senyika. Tazvikumikidza zvikuru neungano ino mukati mamaoko enyu, kuti mapandemics ose namakalamities ose atinosangana nawo mabadzikamiswe nemweya wenyu mutsvene. Ndakunamata izvino muzita raMwari Baba, reMwanakomana neramweya unoyera nokusingaperi. Amen.
Pamusoro vanoremekedzwa, tinoda kumbokwazisawo mambo vari pakati pedu setsika yedu yechivanhu. Saka ndinokumbirawo varume vese vakapfeka ngowani mumusoro tibvise ngowani dzedu. Tichaombera kekutanga. Patinomira kuombera madzimai opururudza, toombera zvakare kechipiri. Patinomira kuombera madzimai opururudza, toombera kechitatu. Patinomira kuombera madzimai opururudza.
Allow me to say all protocol observed. Honorable guest of honor, Dr. Mangwiro, and all invited guests, I am very honored and pleased to welcome you all to Mashonaland West Province. As a province, we are absolutely excited to be hosting the World AIDS Day commemoration, and on behalf of the Mashonaland West family, allow me to extend our warm welcome to all of you. We are very hospitable and we are very excited to be hosting you in Mash Best. Tinokugamuchirai setule mauya. Mashonaland West Province, as you may be aware, has 7 administrative districts with an estimated 143,524 people living with HIV. Out of these, a total of 129,992 are on antiretroviral therapy. As of 2020, the province witnessed 2,152 HIV and AIDS death-related an indication that the pandemic is not yet over, and calling for concerted efforts to respond to it. For us to achieve Vision 2030, as espoused by His Excellency Dr. E.D. Mnangagwa, we must be united in the fight against AIDS and HIV. Ladies and gentlemen, the prevalence of HIV has dropped significantly over the years, from 35% in 2010 to 21. Adult antiretroviral therapy coverage stands at 97%, while that of children is at 63%, according to the 2021 statistics. While this is a great stride for adult antiretroviral therapy coverage, a significant gap still exists for our children, as the province is ranked second last countrywide. I therefore call up investment of more resources towards HIV testing, antiretroviral therapy initiation, and adherence monitoring for children. The children are our future. Honorable guest of honor, Mashonaland West is confronted with a myriad of HIV-related challenges, including child marriages, drug and substance abuse, multiple concurrent relationships, and school dropouts. In efforts to address these challenges, the province, through National AIDS Council and other various implementing partners, developed a models approach for implementation. Kuti chirwere ichi che HIV isu tikaramba tichi ngetiri mu denial hatigone kubatsirwa. Iwe neni tine basa, hapana munhu pano anotaura kuti hakuna wekudzinza rake asina chirwere ichi. Naizvozvo ngatibatanei kuti tirwise chirwere ichi che HIV and AIDS. Stigmatization zvatinenge tichitya izvozvo hakusisina. Mazuano tiri kunyatsokuona kuti hurumende iri kuita pese painogona kuti izvo vanhu vabatsirike pachirwere ichi che-HIV and AIDS. Isu muMashonaland West Province tine nzvimbo dzinocherwa, tine mafisha kumafish camps, tine maprazi kumakomboni. Saka chirwere ichi chinoti one day. Saka zviri kwatiri isu titibatane cheMashonaland West Province tione kuti izvo chirwere ichi tiri kuchirwisa pamwe chete kuti hondo ye-HIV ipere. Zviri kutaurwa ne-theme iripo, no to pandemics, no to inequalities, no to AIDS. Our combined efforts will go a long way in reducing the impacts of the pandemic. And for that, we are very grateful. Iwe neni tine basa. Tinokutendai. Thank you, Siyabonga.
On behalf of National AIDS Council and the entire community of the response to HIV and AIDS, which we coordinate, it is an honor and privilege for me to be with you today as we commemorate the 33rd anniversary of World AIDS Day. Its end inequalities, end AIDS, end pandemics. So we are meeting here today under circumstances which changed in just 1 week because of COVID-19, which has really wreaked havoc in our day-to-day living. But this theme it captures this situation which we are in today in Zimbabwe and in the rest of the world. But for National AIDS Council, the most important thing for us today is that we are celebrating our 20th anniversary. NAC was set up back in 1999 through an act of parliament, and it has been a response to HIV. We know that when we started, the story was sad and grim, but now it's slowly moved into that of hope and success. So in Zimbabwe, we first commemorated it in 1988, the World AIDS Day, and it has grown to be an annual event with various activities lined up for the week leading to this day of 1 December. And all stakeholders and partners really are here today to take stock of progress and look at the gaps and rededicating ourselves to scaling up the response. Ladies and gentlemen, honorable guest of honor, I'm glad to tell you that Zimbabwe this year we are celebrating because we are actually 90 targets set for 2020, and we are proud of the work which we have done. Fewer people than before are getting infected with HIV and dying from AIDS, and it gives us hope to achieving the 95 targets of 2025. But this is work which has been done by government and our stakeholders and partners. We've done this despite facing many challenges. National AIDS Council administers the National AIDS Trust Fund, which is a role model to all countries really on how to resource mobilize at a domestic level. So this money, this resource has been used to test people, to assist our parent ministry in organizing programs which optimize interventions and target all populations, paying attention to location and rights. And we've mainstreamed all these key interventions to our populations, and we want to end inequalities and promote access for both prevention and treatment. But like the previous speakers have said, we have key populations in our communities. These populations continue to remain behind in terms of the HIV program. So we are now targeting them and scaling up prevention methods and treatment methods in these key populations. So ladies and gentlemen, our guest of honor, we need to optimally execute the resources which we have. The funding gap continues to widen, but we are happy that we have at least domestic funding, and we are glad with the announcement of the budget which is coming to health, and we want to applaud our government for that. So there is need to therefore increase domestic investment and adoption of efficient cost savings and mechanisms in procurement and program implementation. As I conclude, our guest of honor, let me express my personal gratitude and indeed that of National AIDS Council to government, all donors, implementing partners, stakeholders, and indeed communities, as well as World AIDS Day Organizing Committee for their roles in the responses and contributions towards the achievements we have so far recorded as we coast towards ending AIDS by 2030. I wish you a happy World AIDS Day. I thank you.
Standing in front of you is Tisita Shemregeri. I was born in 1999. Allow me to share my experience with you. I was born in 1999, HIV positive. In 2012, I got sick to the extent of being admitted at Chinhoyi General Hospital, and I was tested for HIV, and results came positive. I was initiated on art on that very day, but fortunately, fear gripped me because I was an innocent soul. Fortunately, I was introduced to various NGOs like FACT, ZNNP+, where I received the social support and counselings. From there now, I began to understand my status and to understand life, HIV doesn't mean the end of the world, because the pandakatanga kudzana status yangu andakana umboshigamuchira ndakaona seunge ndaifanira kutofa kuti kozi chinjanya ndibata ndichekuti ko what if ndikazoudza my other peers vanotigamuchira sei. But pandakangodzidziswa different NGOs kuti kwan HIV azvire kuti chi upenyu hwapera. Ndakatanga kunzwisisa kuti kwan HIV unogona kutoraramawo zvakafanana nevamwe. Kubva ipapo ndakatanga kuadhiya ndino mishonga yangu zvakanaka.
All protocol observed. I'm being honored to be part of this important event on the World AIDS Day. As an umbrella body of people living with HIV, ZNP+'s role is to coordinate the PLI sector. We are delighted to note that we have been a great support from the government and the donor community, civil society organization, to mention but a few. ZNP+ appreciate the commitment by the government to address the challenges faced by the health sector, especially people living with HIV. A few days ago, the Minister of Finance announced the 22 budget, the national budget, and I must say we are delighted to the country has made us great strides towards reaching the 15% Abuja declaration.
Ladies and gentlemen, comrades and friends, our distinguished guests from all facets of life, the protocol observed. It is my singular honor as the board chairman for Zimbabwe AIDS Network to give our solidarity speech at this august occasion. As Zimbabwe AIDS Network, we remain committed and resolute to ensure that we end the pandemic by 2030 as guided by the SDGs. Having said that, we would like to appreciate the role that is being played by the government as well as other non-state actors to ensure that we remain within the track as to achieve the intended goals and objectives.
It's a pleasure to address you all today. My name is Art Brown. I'm the Acting Deputy Chief of Mission representing the Embassy of the United States of America. And my day job is being the Director of USAID, a funder and a supporter here in Zimbabwe. Again, it's a pleasure to address you today as we commemorate World AIDS Day and reflect upon our collective efforts to bring Zimbabwe closer to ending the AIDS epidemic as we know it. This year is especially poignant as we mark 40 years since the world officially reported its first cases of what later became known as AIDS. Today we wear red ribbons to commemorate those who have lost their lives to HIV and the struggles of those who are still living with HIV. Let us take a moment to remember those who we have lost, to remember there is still much to be done in the fight against HIV, and to recommit ourselves to doing whatever we can to finally stop this disease from taking one more life. A year ago today, results from the PEPFAR-funded Zimfia 2020 survey found that not only has HIV treatment been greatly expanded in Zimbabwe, but over 3/4 of adults living with HIV have achieved viral load suppression, meaning they have effectively no risk of. We can and should celebrate the extraordinary progress Zimbabwe and the United States have made in providing life-saving treatment to the 1.2 million Zimbabweans living with HIV and AIDS. Each day our collective efforts bring Zimbabwe closer to ending AIDS. Our strong collaboration with the Ministry of Health and Child Care, multilateral and bilateral health, civil society organizations, and people living with HIV has enabled the success we commemorate today.
It is an honor for me to deliver a short message on behalf of the United Nations system in Zimbabwe as we commemorate this year's World AIDS Day. I would like to acknowledge the progress that Zimbabwe has registered in drastically reducing deaths related to AIDS. Government, non-governmental organizations, cooperating partners, donors, communities have worked in strong partnership to achieve and contribute to this progress. We are grateful for the leadership and stewardship provided by the Ministry of Health and Child Care, the multi-sectorial coordination performed by the National AIDS Council, the continued generous technical financial support by donors. Due to the rapid scale-up of HIV/AIDS care and treatment in Zimbabwe, over 1 million Zimbabweans are now living with HIV and are living active, long, and productive lives. An HIV-free generation in Zimbabwe is on the horizon through better care and treatment, as well as through the elimination of mother-to-child transmission.
And honored to have been invited to address this important occasion to marking the year 2021 and 33rd commemoration of World AIDS Day, as well as the launch of the annual campaign whose theme is End Inequalities, End AIDS, and Pandemics. The World AIDS Day has become a key platform for nations to remember those that have died of AIDS and reflect on the progress in responding to HIV, which has now been compounded by its twin pandemic of COVID-19. We are all constrained circumstances due to the prevailing COVID-19 pandemic. Although the pandemic keeps changing and assuming new variants, I am glad that government has instituted bold steps which have already engendered positive outcomes. Both the number of infections and the number of people succumbing has tumbled. This positive development does have prevailed over the pandemic, but a reminder of the strides and achievements we can attain if we work together as a nation. A lot of work still lies ahead for us to be fully equipped to deal with new waves and variants whenever they occur. Distinguished guests, ladies and gentlemen, in our endeavor to strengthen the response to COVID-19, we are cognizant of the HIV and other pandemics, including non-communicable diseases, as this year's theme portrays. The recent emergence of COVID-19 has exposed our systems, and I'm happy that government is prioritizing the whole health deliveries. Better deal with future pandemics. In this regard, my ministry is spearheading the construction of 32 new hospitals, ensure that all people have access to modern healthcare services, and remove all inequalities in the provision of healthcare. Despite the COVID-19 induced disruptions to HIV services delivery system in 2020, our response to HIV has now rebounded and continued to firm. I am pleased with the trajectory of new HIV infections, which shows a continued decline for all age groups over the years, from 40,900 to 24,900 between 2016 and 2020. Among adults, the number of new infections has declined by 42.1%, whilst in children, it declined by 22.4% between the same period. Among the 10 to 19-year-old age group, infections declined by 44.3% and by 44.4% among the 15 to 24-year age group. In addition to these declines, the national HIV prevalence has dropped from 13.9% to 11.8% during the reporting period. Ladies and gentlemen, the above statistics show that HIV prevention interventions we have rolled out, both biomedical and social, are bearing fruit. Government is geared to scale up these measures with a focus on high-impact ones such as targeted HIV testing, voluntary medical male circumcision, post-exposure prophylaxis, prevention of mother-to-child transmission, and treatment as prevention, and others utilizing the differentiated service delivery approaches to adequately address HIV, and technical partners who have ensured our response to HIV remains afloat. Let's give them a pom-pom. Government, through the Ministry of Health and Childcare, is committed to ending all inequalities related to access and utilization of health services as a bedrock upon which we will end AIDS and all pandemics. This will require collaborative efforts, including policy and legal safeguards, as well as scaling up of interventions that have worked in tipping the scale of HIV, COVID-19, and other pandemics towards a trajectory of ending them as public health threats by 2030. As I conclude my remarks, I would like to thank the National AIDS Council, implementing organizations, people living with HIV, and communities for their hard work in 2021 to tame HIV and other pandemics despite some challenges. Your contributions and participation have continued to make our response to HIV robust and successful. I thank you all. Tatenda, Siabonga, Messi.
Is very encouraged to see how far the HIV positive people have done. They've done very well. You can continue. I want to encourage all of us not to tire, because when we are told what the positivity rate is and so forth, we always think we are not doing much, but we've done a lot to be where we are. Someday we will succeed. If we are all committed to the youth who are here, no need to hurry to start having sex. You have the world to you as you grow up. Look after yourselves and educate those who are lost. Because I find that the youth always cheat itself and do the things which are not supposed to be done. But also have a compartment where you are actually doing the right thing. Because a lot of you look at it, they've come out from that positive status where they were doing nothing. They are doing something because they looked after themselves. So I'm hoping that, one day we will be coming together to say this is where we are. We have done very well, and the youth are doing well. Look after yourselves and educate those who are lost. I'm expressed by the president. So really we must thank all those people, thank even the present or that has been given by doctor, to one of the girls. to proceed in a thing. So look after yourselves. This is the end. I thank you all for having come to this meeting. Thank you.
Thank you.
Bhaskoro aya achatidetsera pakurwa nechirwere cheAIDS uyezve mamwari kuva yeCovid-19 zvoda kuti coordinator vanhu vambodzipaka mabhasikoro avo movapoka magurukomita vagocheka chipa movapa mabhiki nechini kuti vagocheka mabhiki kuti pavasvika vanobva vapedza basa rese pamwe nematemomita. Saka tomirira tichidaidzira kuti vari kutuwa ndivanani tichapagumi chete asi tine makumi masere mashanu mabhasikoro zviri kuna inonzi matirisi haaremi kwakuisayo akanaka chaizvo. Saka wekutanga watipa bhasikoro rekushandisa munharaunda unomu ndikuti chibale.
If you don't
end pandemics, end inequalities, end AIDS. Pandemics such as COVID-19 have exposed people to HIV.
Uqinisile abantu balo bengakwanisi ukuyathola uncedo ezibhedlela ngokufanele ezindlini.
Unowana seiru batsiru usingavumirwe kufamba.
No movement, no access to testing and treatment.
End pandemics. We demand equality in HIV matters. Men and women must have equal rights.
Akumelanga omama besabe ukusebenzisa amakhondomu lezinye indlela zokuzivikela ngekhaya.
What suits you suits me. Okufanele mina kufanele wena. Atina kusiyana, tinoyenzana. Think about it. The time is now or never. We are in this together. Tikayenzana, tikabatisana, tichapeza AIDS.
Let's give HIV and AIDS equal resources in our national budgets.
Listen.
Lalela uzwe.
Tell uzwe. If we end pandemics and we end inequalities, we end AIDS.
Down with inequalities on HIV issues, Panze!
Panzi, Polo, Tarama, Siala.